Hey everyone, welcome back. Today I want to talk about compensatory patterns at the low back, the pelvis, and the hips, and how you can use some simple exercises to recover postural integrity, decrease stiffness, decrease pain, and decrease also those compensations that are getting you into some tight spaces that make it difficult to move and maybe unlock some of that natural ability that you seem to have lost. So we want to start with this idea of an infrasternal angle. So this angle right here can be wide and it can be narrow. And depending on what your personal infrasternal angle is and the natural posture of your rib cage, that can kind of tell us how we can use exercises to recover from some stiffness, from some tightness, and even recover from pain. So the scenario that I want to bring you today that I dealt with one of my patients today was someone who did have a narrow infrasternal angle, and as a result of that narrow posture through the rib cage, we also know that they were in essence locked into external rotation at the hips. So what that might look like, if I can just bring another model up here so you can see it a little more clearly. So narrow infrasternal angle, that's going to tell us that they're going to be externally rotated through the ilium on both sides of the pelvis, and they're going to go naturally into hip external rotation as well. What that does is it usually results in hyperextension of the low back. It certainly did for this person. And then it also results in a loss of hip internal rotation. Okay, so what we need to do is we need to loosen up the posterior aspect, the pelvic outlet, so that they can recover internal rotation at both sides of the pelvis, the ilium on both sides, which will allow them to more easily recover internal rotation at the hip, and that in essence will also help them loosen up their low back. We want to get out of this scenario where we are, because of that natural infrasternal angle posture, where they're stuck in this natural anterior pelvic tilt, which would even result in a ribcage flare, keeping the sacroiliac joints, the ilium on both sides, keeping those externally rotated and creating a lot of compression across the lower back. So what we want to do today is show you how using a hyperextension machine and understanding how you want to position your hips and your feet on the hyperextension machine can help you once again loosen up the low back, loosen up the tailbone on both sides, recover hip internal rotation, and decrease stiffness and pain. So let's get into it. Okay, let's talk foot contacts for a moment. So as we're using this hyperextension machine, the thing we really want to be aware of if we want to restore hip internal rotation as well as find those inner thigh muscles and get more hip extension out of gluteus maximus is that we want to make sure that we maintain contact with. Don't overdo this, don't overthink this. We just want to find the base of the big toe, the knuckle of the big toe, and we want to find and become aware of the inside edge of the heel. If you will maintain contact with those two positions right there, bring awareness to those two positions, you're going to find that you can begin to recover that hip internal rotation. You can begin to recover hip extension rather than just being constantly biased into hip external rotation. So here's the hyperextension machine. Let's go ahead and give it a shot. So we're going to lock in here, make sure that this is at the right length for you, for your body type, and we want to be able to hinge over the end of that machine right pretty much at the what's called the ASIS, the anterior superior iliac spine, those two bony prominences on the front of the hip. Now, when we do this exercise, you see a lot of people coming up as high as they can, really getting into extension. We don't need to do that. We only need to come back to that 45-degree angle because we're more concerned with lumbar flexion. I'm looking for that inside edge of the feet on both sides. I've got the knuckle of the big toe, the base of the big toe. I've got the inside edge of the heel. You're going to feel more adductor inner thigh muscle. You're going to feel more inside hamstring, and you're going to feel more hip extension through the glutes. I'm going to cross my hands over. You can put your hands overhead if you want to, if you're a little more advanced. Now, when I go down, I'm going to exhale. At the bottom, I'm going to take an extra moment here to breathe in. I've still got my inside foot contacts. Breathe in. This is where your lower back extension and restoration of your lower back flexion is going to occur. So lower back is filling up and expanding. Lower back, so I'm biasing my lower back into more flexion. Now I'm going to exhale, come up, but I'm not going to go too far. I'm only going to come back to that 45-degree angle, maintaining those inside foot contacts. So try 7 or 8 of those. If you're a little more advanced, 10 to 15, add a weight. If you want to, you can hold that close to your chest. Exhale, expand the lower back, keep those foot contacts, breathe in, and find more lumbar flexion. That hip internal rotation is going to be restored. As you exhale, come back up, maintaining those inside foot contacts. Lumbar flexion, lumbar expansion, hip and pelvis, internal rotation. And that breathing pattern is really important. Hip internal rotation is associated with breathing out or exhalation, And hip external rotation is associated with breathing in or inhalation. So I hope that was helpful. If you have any questions about that, let me know. If you're wondering if you're centrated, if you're laterally biased to one side or the other, if you're wondering about your infrasternal angle and whether you're naturally externally rotated or naturally internally rotated at the hips and the pelvis, give us a call. We'd love to talk that over with you. We'll see you again here soon.